So we just saw Challenge.gov go live.
Yes.
Imagine you're excited?
Of course we're excited.
Yeah, go figure. So how long did it take to build?
Actually, there was not much building to do. We had a competitive solicitation run by the General Services Administration, and they got all off-the-shelf tools. This was one of those free procurements. We didn't actually have any resources to invest. And I don't have the particulars of the number of firms, but several participated, and Challenge Post came out on top. Although we have other platforms on the apps.gov storefront so that agencies can use alternative models. This is not a mandate or a only one way or the highway model. This is simply a service that makes it easier for the agencies to share in a common way.
Sure. So we covered Challenge Post a little bit, so I'll refer people to that coverage and to the Challenge.gov context. And you just talked with Tim along with Vivek about that, and Bev did too, so we can let that talk stand for itself.
Yes.
I do gather that you've got, I think, over 30 challenges there now.
Yeah, there are 36 that are posted as of today. These are new and more likely existing challenges that have yet to close. Okay. So what we wanted to do up front was to kind of have a single voice for all of the existing challenges, just to show people the breadth of what's already occurring, and then to encourage more agency participation. I think 16 agencies as of today are listed. In fact, we had 2 challenges announced here at Gov 2.0. Todd Park at HHS, who's the CTO, and then my de facto CTO at Education, Jim Shelton, just announced one moments ago.
So they're all in the larger context of trying to involve citizens in co-creation of government.
That's exactly right.
This open government directive says you got to get that transparency aspect with publishing data, but participation and collaboration. What other ways are you actively trying to empower citizens to participate in their government?
I would say if 2009, our first sort of full year, was about the data platform, data.gov, I would argue that 2010 is about thinking through the participatory platforms. Challenge.gov is our most visible, but we also have relaunched the Federal Register, which I believe makes it a lot easier to digest the news of the government so that new ecosystems may emerge that will galvanize people to mobilize on issues that maybe they wouldn't have thought would have been an area of focus for them. So I can't tell you at this moment in September of 2010 that we've got like the recipe for the single ecosystem development platform concept. But what we said today in our talk with Tim was that we acknowledge that from a technology standpoint, there are half a dozen things or so we've done to kind of seed ecosystems, but we want to now explore how to better organize ecosystems. I got to tell you, my personal favorite is what Todd Park is doing at HHS and what Jim Shelton's doing at Education, because they are really understanding the dynamics of their domains and thinking about how to get the right conveners to sit at the table and bring folks to accomplish the task. On words, none of these initiatives are different than the other, but in terms of who's doing the work, who's investing the time and energy, how much CEO attention is here, that's where you're starting to see some variation. And I'm very pleased with what we're starting to see happen at HHS and Education as an example.
So with respect to convening, this is actually something that goes straight to your role versus Vivek Kundra. He's a CIO, he's got budget.
Yes.
Right.
And he's doing a phenomenal job with that very massive responsibility.
Right. Your role, a little bit different as
yes.
a CTO. Different organizations have their CTOs do different things.
Yes.
The U.S.'s CTO, you are doing what? Bringing together the tech community to help solve challenges?
That's part of what I'm doing. I would argue what I do is basically 3 things. One, the president called for me to serve as one of his assistants. He's got about 25 assistants to the president. And what that means is that any issue that comes before the president is looked at by this group of 25 senior advisors. It's people like Larry Summers in the economy. It's obviously people like Carol Browner on energy and environment, Nancy Ann DeParle on healthcare. And what this group does, we meet every morning at 8:30. It's sort of a very formal part of our process. I make sure that the technology, data, and innovation aspects of any given policy that comes before the president are thought through and are considered in a little bit more of an aggressive way. So in a sense, I'm issue spotting for the president as part of my first task. The second task is convening internally and externally. And what that means is inside the government, we've got lots of agencies focused on lots of issues, but they often come together. We're in the middle of a conversation right now about standards policy. what is the role of government in standards? Well, we know generally speaking we rely on the private sector to set standards. But there are examples where we push a little bit more aggressively, we take a more active role, a little bit less active role. So we care a lot about healthcare data standards. So what is it that we're doing as a policy matter? So what we're trying to do in the convening role is get voices from across the federal government to have a consensus set of recommendations for the president's consideration on key policy matters that affect kind of the private sector's technology role. Then on the external side, I'm very bullish on public-private partnerships. We announced the Text for Baby program in February of this past year. It's one of the president's few announced public-private partnerships. 75,000 women are now getting that information. Zero government investment. We simply convened, and that is something that we enjoy doing at the White House, and we're keen to do more of them.
So does this mean when the president wanted his BlackBerry, he came to you?
No, he went to the IT department. I love it. I have played the role of IT help desk in many a meeting, I must assure you, and always looking to be helpful wherever I can be.
So in terms of thinking through some of the ways that government is using technology differently, you can point to a number of things. I mean, the relaunch of different .govs,
yes.
USA.gov certainly, the Federal Register is significant, as you pointed out, and the launch of many new ones as well. What are the things that you're thinking through in terms of the mobile strategy? Because everyone in the tech industry is thinking about mobile now. It's not just about social, it's not just about apps, it's really thinking through the fact that every consumer is on their phone. How do they get information? How is the government responding to that?
Well, there's a threshold question about infrastructure. So the first question we're asking is, since we have responsibility for the airwaves, do we have the right policy framework that will meet up with the demand? Will the supply and the demand intersect in a thoughtful way over the next 10 years? So this president has called for a near doubling of the amount of spectrum that's available for mobile broadband. So that's threshold question number one. Threshold question number two is, how do we do more off-government agency development work that could be done in a mobile context or not? And so the more we rely on APIs and app development, the more we're naturally seeing mobile applications come. A, they're easier to develop, and B, there's a whole ecosystem now forming around making it even simpler. So we launched the First Lady's Apps for Healthy Kids competition. Out of the 100-plus applications that were registered, I think the overwhelming share had a mobile component. Now we're in the middle of surveying them, so I don't want to make too much of a comment until we announce the winners. But mobility is a key element of that. But I would say it as a policy matter. We're injecting mobility in key policy areas. So we're in the middle of a 2-year review for the networking and information technology R&D portfolio. It's a $4 billion research and development program, and it's run out of our office at the Office of Science and Technology Policy. So I've challenged our private sector advisors who are looking at the program to ensure that it's run well and is focused on the right set of issues to pay particular attention to mobility. That was my homework assignment when they got started. And our hope is that by November, when they issue their report, we're going to see a reflection of how we move the R&D portfolio to acknowledge the importance of mobility. And we're doing it in specific areas where it's mission critical for the government. The president said one of the first things we're going to do in spectrum policy is, as we deliver results, i.e. We generate cash from auctions, the first thing that's going to get financed is the development of a national public safety interoperable broadband network. Well, that's mobility for public safety. And right now we're having conversations with the private sector, with the first responder community, and we're having a summit at the end of September to kind of bring these forces together. Our goal is that by the end of this year, certainly in time for the president's budget, we have announced a coherent strategy for how we're going to go about building a mobile broadband strategy for our first responders. And there'll be spillover benefits, I think, coming from that work.
So I'm watching what's happening right here in D.C. The D.C. CTO, CVAC, actually announced that they were able to roll out Wi-Fi in the National Mall.
I saw that.
Went and checked it out. Worked great. And they're really thinking through how to use some of the underutilized dark fiber here in the city to roll out connectivity towards 5, 6, and 8, which are traditionally the places which are underserviced.
Yes.
But the danger, I think, in this space is to sometimes forget how many people don't have connectivity or digital literacy. How much of that is on your plate? How much are you thinking about ways to get beyond the fuzzy new app, or I should say shiny new app, not too many, they're fuzzy, and move on from there?
I'm going to make 2 comments. The first is that in the National Broadband Plan, written very well by my dear friend and colleague, the FCC Chairman Julius Janikowski and his team, When they published their report, the president asked me and our team to sort of provide for him guidance on what the administration's position is on a number of the recommendations. Digital literacy was amongst the top priorities and is clearly emerging in our internal conversations as an important area for us to comment. Now, we're not done with our work, so I don't want to get ahead of our final conclusions. But I'm more than confident that digital literacy will be an important part of the overall policy. How big and exactly what we're going to do there is yet to be announced. The second thing I would say is that we're acknowledging the role of proxies. So I spent a good deal of my time this summer implementation work on health reform. There was a section called 1561 that called for, in 180 days, standards that would allow for the best customer experience for folks that in 2014 will be interfacing with these new insurance exchanges. That is, the 45 million Americans who will for the first time be accessing new public services. That program called for a technical architecture, not one that would inhibit policy decisions that are yet to be made in terms of who runs them and how and so forth, but could be the foundation. Because we acknowledged mobility will be an important component of this, one of our advisors to this was Oren Michaels from Mashery, which is sort of a startup in Silicon Valley. And Oren, one of his clients is Netflix. When Netflix wanted to have a mobility strategy, Netflix wrapped an API that Mashery helped support and actually encouraged third-party developers to be essentially the R&D function for what new products could be launched in the mobile environment. And in the same spirit, we put recommendations in the technical standards framework that basically said federal agencies should provide web services that would allow for their data to be accessible not only by the state and local agencies that want to interface, but third-party developers, whether they be in a mobile context or otherwise, who could then build out services on that infrastructure. So we're now taking those concepts and embedding them into broader policy discussions, not just these one-off interesting little projects, and that's a key part of our 2010 work.
So it turns out that implementation is a lot harder of open government than the issuing the directive.
We knew that.
No one was shocked by that.
Yes, but that's the fun part. We're equally focused on execution.
Right. So what, in terms of the lessons learned, what hasn't gone as well, and how are you adjusting? Because this whole idea of being more agile in government is failing, and learning from it and speeding up the loop of learning.
We actually welcome that concept of that learning loop. I would say we had to strike a balance when we launched this program. I was tasked with providing recommendations that resulted in an OMB directive. My pressure was, how do we create enough central goal setting with enough freedom that would tap into creativity and entrepreneurial thinking at the agency level, so they didn't literally have to check each box and say, yes, sir, yes, ma'am, we've completed all of these tasks. Here's our 300-page monstrosity of a report, and here's our strategy to execute against it. What we said was we wanted to see a lot of variation. Some agencies, so probably the single biggest area where the variation is maybe not to the best of what our expectations are, we're in the data inventory, high-value data section. Obviously a very key priority for the administration. We've got a platform that Vivek helped stand up on data.gov, a focus that this is an important part of the administration's strategy. And we saw the Transportation Department build a robust information architecture that really allows for kind of an evergreen process for new data that's evaluated for its high-value potential, scored in a manner that actually is structured, and therefore leads to publication. All the way to the ad hoc. Well, a certain stakeholder group gave us some feedback, and so we're going to make that a priority. And everywhere in between. So what do we learn? Well, we learned, thankfully, we never would have designed the transportation information architecture strategy if we were forced to do it in kind of a top-down way. So, number one, we saw innovation to the good, in that they exceeded what we ever thought they could do. We also saw innovation to the not so good, in the sense that some folks just haven't really lived up to that expectation. They're getting better at it, and they're trying to move forward. That's why we had 2 rounds of evaluation that Vivek and I had on the agencies. But the lesson learned from this is that you identify best practice and then you rapidly scale. So we've taken the transportation model and we've highly encouraged the agencies to replicate, because it isn't that costly. It's actually more of a process that works well internally. And you're going to see more of that targeted scaling. If you think about innovation generally, we typically find 2 gaps in society at large. There's the gap of the idea itself to proof point, can this idea actually work? And then there's proof point to scale. I think we've done a good job of creating the conditions for proof point validation of innovative projects. There's so many that are featured even here at the conference. It's the proof point to scale that Vivek and I are grappling with in terms of a challenge going forward, and I think we're going to have some fits and starts. That's why things like Challenge.gov is an example of scaling an area that we could do. We can take the benefits of what was done by some of the agencies and ensure that capacity is available for all.
In terms of the big idea of releasing bulk data in machine parsable, readable formats, something data.gov does to the extent the data is solid.
Sure.
What kind of ecosystem, one of your favorite words, I know, of apps have actually come out of that?
I would argue, if you look at the Community Health Data Initiative, because you've married, we had a slide that we presented today, which I'm hoping can be available on link or something to the audience, that said platforms plus public participation equal results-driven ecosystems. So you would ask the question, which agency has got the best organizational principle of public participation? And I would argue that Todd Park at HHS is, if not the best, then close to the best. And why? The core mission statement of HHS is to improve health performance throughout the country. The convening body that has got the universal reputation for excellence is the Institute of Medicine. So by getting the president of the Institute of Medicine and Secretary Sebelius jointly to say, we want to convene at the highest levels thought leaders, 25 of them from the public health community, 25 of them from the Web 2.0 community, thank you Tim O'Reilly for joining, and mash them up in a conversation. We had the same data sets that were available. It's not like they innovated on the technical design of better machine readability or more better parsing strategies or whatever. It was the ecosystem development that was the innovation. And what's come out of it? Well, I'll give you some of my favorite apps. I'll give you two. Microsoft and Bing, their product Bing, basically took hospital quality data and patient satisfaction data and integrated it into their core search results page called Bing Health Maps. And that means that the data that we've had sitting in the HHS in a machine-readable format in accessible ways, but just not utilized, now will be seen by far more people because they have more likely to frequent Bing. That judgment that Microsoft had to make that investment, we didn't pay them for it. We didn't ask them to do it. We simply said, will you participate in this ecosystem? And that's what their senior leadership came up with. Google, others had the same thing. But we also had the flip of that, which were apps that were even agency apps. My favorite was Pillbox, I think was featured here. In fact, I identified David Hale, who's the employee at the National Institute of Health. Pillbox's basic idea is let's keep an open library of what the images of certain medications look like so you know what you're looking at. We get requests all the time. I've got this blue pill that looks like this. Is this toxic? So by having this open platform, now there are going to be lots of applications, I hope, powered by Pillbox, the Pillbox database. Because of this, I appointed David to the Health IT Standards Advisory Committee because he had that rare talent that we were able to identify and bring him into the policy-making apparatus. I don't know if that's what he normally would be doing or not, but we found him. Those who seed ecosystems well, that have the buy-in from the leadership of the policy side, or in the business community, you might say the owners of the business, the biz dev or the revenue-generating side of the house, the minute they adopt a technology strategy, you're likely to see more success because it's going to be endorsed and adopted. And that's what we're talking about today with Challenge.gov.
So should government be developing apps itself, like the ones you see at USA.gov, or they should be creating a platform for doing it? Or
we're going to be doing both. I think what you're going to likely see, if I were to sort of make a broad generalization, I don't speak for every federal agency, and Vivek and I have had many a dialogue about this conversation. What we're basically agreeing to is that there may be a room for some reference implementation apps that kind of get the ball rolling. That are done in a manner that can help accelerate private sector and nonprofit app development. So the Apps for Healthy Kids is an example. What we did there was we had funded years ago a video game, a web game, that would help you learn about nutrition. We basically open sourced the game code and incorporated that into the Apps for Healthy Kids Challenge. So yes, we had funded in the past this first-time implementation. We made the data accessible, and we basically made both assets available for third-party developers. I haven't heard feedback yet if that made it easier to develop apps or not, but that may be more of where we're heading. And I think that's the logic and the spirit. You don't want to just have the raw data alone. You might if it's about a purely private sector thing, but if it's in a mission-oriented area where the government has an active role to play, then the way it could have an active role is by investing in that reference implementation and then seeding the market to build alternative products.
So last question, because I know you probably have to run to someplace next.
Yes, sir.
This is something that Tim hit on and that former OMB director Orzag blogged about.
Yes.
Right? The IT gap.
Yes.
There's an IT gap on many different levels, right? It can be even with intra-agency. It can be within the government. But persistently, it's between the private sector's use of IT and the public sector. Why is it there, and what are you doing to change it?
Number one, it is because the DNA of our federal agencies, from procurement policy to how they go about issuing requirements, that whole process for acquisition has largely rewarded the acquisition of yesterday's approach as opposed to investing in the adoption of first proof points of the new approach. So there's a more fundamental question about what's considered core IT development and what's considered the end product that adds value. What we're seeing is more IT development for back office purposes, accounting for a higher share of the overall IT spend than the mission-driven oriented development activity that actually has the ability to produce the policy objectives that are called for. So I would argue that there's an acquisition challenge, there's been an oversight challenge, an accountability challenge. Vivek is all over all of that. To the extent that I have a particular voice and role in this conversation, it is how do we more closely align the R&D and the innovation ecosystem as first adoption points in government as opposed to last adoption points. And I would say for this, the one I'm personally involved in, because healthcare IT is so close to my heart, we invested in an R&D program at Harvard called SMART, Substitutable Medical Applications. Basically, it's a research program designed to create what they call the iPhone App Store for healthcare applications. Not only have we invested $15 million to get that research going, and they've built a world-class team of advisors from Clay Christensen at Harvard Business School, Regina Hertzlinger, to private entrepreneurs. They've also, what we've done is we've also encouraged the VA and the DoD to visit with them to be a first adopter. Maybe not for the whole VA DoD system, but in a small pilot that's governable. So for the first time, perhaps, we're bringing not only the research dollars, but we're also bringing the first customer to see if this actually has potential to succeed. We think this does dual benefit. It will actually accelerate the private sector innovations, and it'll also start with it in mind, how do we bring it into the government early? And I would say, finally, look at Blue Button. President announced in August that every member of the VA who has an account that can look at their healthcare data on their My Healthy Vet website, the president said in August, I want you to push a blue button and allow you to download your own data and do with it what you wish. Share it with another doctor, whatever. It's your data. You do with it what you want. By the way, that went live a few days ago. Soft launch, no marketing. 10,000 veterans have downloaded their data. How many private sector personal health record ecosystems today allow you to push a blue button proverbially and download your data? It's an example where we're actually, I think, on the cutting edge, and I think we'll be catalyzing more breakthroughs. So the Markle Foundation announced the challenge: lunch with Clay Shirky and $2,500 if you can build a blue button reader or an app that builds out the ecosystem. Mark my words, dozens of private companies will be sharing in this Blue Button program in the coming months.
Okay. Well, I'll be following up to see exactly how this is borne out, and we'll go into 2011 and see about the year of implementation.
Yes, sir. Thank you for your time.
Thank you.